cookies, courtesy Josh Boucher's personal delivery of them earlier today. If you haven't, please grab your cannoli out in the refreshment area. My next task is to introduce Casey Burns for our next session, which is entitled, as I frantically flip through the program, it's a micro session on food security. So Casey is the director of the Coalition for a Healthy Greater Worcester. She's an alumna of Clark University, and she's the co-chair of the Central Massachusetts Center on Food Equity. Let me say this much on Casey. Pretty much, you're all aware, I think, that the Worcester Bureau has issued reports on a wide range of topics in the last year. It virtually doesn't matter what topic. Casey is involved in her role chairing that coalition. So broadband access, Casey and the coalition were there. Fair free transit, Casey and the coalition were there. Residential rents and housing in the city, they were there. Food security, they were there leading the way. So we're very fortunate to have such a strong community base for this conversation, thanks to Casey and her cohorts. And at that point, I'm happy to hand it over to you, Casey.
Thanks so much. Pleasure to be here. Everyone, welcome to Worcester, for those of you traveling here. Thanks for that very generous introduction, Paul. But yeah, I'm here to talk a little bit about our work on using data to create policy and programs to really address inequities in our food system. And I'm going to talk a little bit about the frameworks and what we use and the way that we partner with our research bureau, as well as many other organizational partners in order to do the work we do. But I think I'm supposed to point this way. Okay, so the Center on Food Equity is a relatively new kind of conglomerate organization. It is it's an umbrella organization that brings together 3 existing coalitions: the Taskforce on Food Security, the Worcester Food Policy Council, and the Central Mass SNAP Coalition under the advocacy umbrella, which is housed by the Worcester County Food Bank. And so we represent organizations, community members, funders, nonprofit organizations, institutions around food security issues, sometimes working on policy, some on programs, some on emergency response, some on long-term planning, depending on which part of the coalitions that we're working on. The Task Force on Food Security came together under COVID in order to form a community response there to what we saw as really the stress need around food security, but the Worcester Food Policy Council has been around for about 18 years. So building on a long foundation of collaborative work here. I think I already said all this, but that's our coalitions. So when people talk about food security, often they think this: let's put boxes of food in front of people who don't have boxes of food. Let's put more produce or healthy food, how we define that, where people are shopping for it. Let's teach people how to eat more broccoli. It's really, sometimes we kind of simplify our solutions just based on connecting mouths with food. However, I'm really bad at this. However, what we've been trying to do is really use a more systemic and research-based analysis to show the drivers to food security are way more upstream than when we get to this individual behavior of how much produce, how much vegetables, how much healthy food that we're actually eating. And so we did a study recently with Tufts University, their Catalyzing Communities program, where we used a community stakeholder process, and I'm going to show you. We actually developed these causal loop diagrams to really understand what are the complexities of the human experience that impact their ability to access the food that they need to keep themselves and their families healthy. And the kind of cheat sheet version to this is what we came up with is that there were 3 kind of central pivot points to this. And those were financial resources, basic money in the household. It was how much time you have in the day in order to prepare food, to shop for food, to get for food, to think about food. And then it was unfettered access to federal benefits. But the complexities of what drove those central pivot points that added or subtracted to this were actually much more complicated and much more dependent on social drivers. so bad at this. So we use these research techniques called causal loop diagrams, and we had community members actually draw out what that looked like, step by step in their experience. And this is an example of money in the household. And you see here that, your childcare budget, your housing budget, your medical bills, your ability to work based on your physical and mental capacities, your ability to access jobs really determined how much core money you had in your household. And the core money in your household then determined what you had to be able to spend on your budget. And it wasn't about teaching people that they should think about being healthy, that they should want their families to be healthy. It was just about that basic access. And there's this saying in these circles of rent eats first. And I think this really exemplifies this, where we see this direct correlation between your housing costs and your food budget, as well as these other kind of determinant factors in your household spending. And so this one shows the time in the day and what are the kind of determining factors that impact your time in the day. And that may determine what kind of jobs you have. Do you have one job, or you have more than one job? And, navigation of all of that. What is your transportation system? Are you taking the bus? That's going to take a lot longer than it's going to take to then if you have your car and you're able to go to pop out to the grocery store and come back. It's going to take more long-term planning, more complicated systems, and more vulnerability based on the vulnerability of those systems. It's also impacting your mental health, your ability to connect to community support, your mobility, your access on health. A lot of these things may feel kind of like common sense. However, it was rare for us to see these drawn out and to actually think about what are the critical pivot points and opportunities that we have that impact these, that can really leverage a difference in people's experiences. And then this last one is the impact of the cliff effect and access to federal benefits. The cliff effect is a phenomenon many of you are probably familiar with, where actually the way that federal benefits like SNAP and WIC and cash benefits are structured is that the way that they are structured is that people are often actually de-incentivized at certain point in their income to make more money, because making more money, a dollar amount in your paycheck, will actually result in net less resources in your household, because you'll face this cliff in your benefits. You'll be cut off in your benefits. So you're de-incentivized to actually make more money. And so this complexity in being able to balance the cliff effect, the complexities of maintaining your benefits, really is a complicated web that was impacting people's core ability to provide food in their households. And so in these cycles, what we saw in all three of these was that all of the loops, and this was validated by the research practices that we followed with Tufts University, is these loops we could show were also really intersecting with people's identity and how close they were to experiencing either power or oppression in their lives. And that if you entered loops, and we could actually measure this, at a deficit, the feedback loops would be what we would call vicious, meaning that you would enter them as a deficit and you would continue to decline, and your condition would continue to worsen. The central pivot point would continue to lessen. Whereas you entered it in the positive, it would be virtuous and you would continue to improve. And so we can really map out and start to see how inequities play out in food security according to these inequities and oppressive factors that we see, societally with our values. And so that's just one of the pieces once we start to lay this out, and this is really the big picture with these causal loop diagrams. These are the driving factors, and we start to think about food security is not, yes, we need to think about individual downstream factors like connecting an individual to food, but we also need to, but we're not, it's that same adage of you rescue the person's picnicking by the river and they rescue a person out of the river. They rescue another person out of the river, your body came floating down the river, you rescue another one. At what point do you look upstream and say, what's throwing people in the river? What's happening? Yes, it's going to be important to address the needs that people have, connecting them to food. We're never going to say that that's not important. Food pantries are an incredibly vital resource. Getting people food. I just was answering an email on my phone of some Haitian refugees that were put at a hotel new to this country, did not have any access to food in their hotel rooms, didn't have kitchens, didn't have refrigerators, didn't have any cash. We need to get them food, which I'm literally was just responding to, but we also need to think about what are those systems that are putting these in the places, and how can we use research to really understand and look at what are the pivot points, what are the opportunities, how do these system points work together. And so using that as our overall framework, we look to dive in and understand people's experiences. And we worked with the UMass Medical Center Prevention Research Center recently over COVID, and we looked at information from the Greater Worcester COVID survey, as well as the Massachusetts, as well as focus groups conversations that we had. I don't know why it likes to go backwards. And we saw, from this, from the data that we saw, validation of things that we saw, more than 1 in 5 people reported being food insecure. Rates were greatest around these identity populations, Latinx, Latine, African American, Black, Asian respondents. Rates were greater among non-English speakers. Rates were greater among respondents under age 50, where we really saw, the kind of experience through the surveys validating this kind of framework that we had outlined as well. And then we, have kind of summary of these themes that came out in our focus groups, quotes, testimonies, stories from people that we heard from when we talked to folks. And we summarize these and are creating and elevating these voices into policy development, both locally, statewide, as well as nationally. The White House recently had their second ever conference on hunger, and we sent a few of our coalition partners to the conference to attend in person. And we also created testimony and feedback for this that we submitted to the White House in their development of their 5 pillars that they're using for their national policy agenda. And so we are continuing to look and partner. Most recently, we also had a really powerful partnership that Paul mentioned with the Research Bureau here locally, where we looked at we looked at the data across our city on these factors that were used in the causal load diagram. We looked at where we saw people's access to SNAP benefits, where we saw food resources like retailers and food pantries and other free food resources, and we're able to show that those neighborhoods, those populations that faced greater areas of oppression, of racism, of classism, of sexism, faced additional evidence of showing higher rates of food insecurity. And so this is just a few maps where we'll see the darker areas. I don't know if you've already seen these from the Research Bureau, but the darker areas really highlighting our central core corridor neighborhoods where we have higher populations of Black, Latine, and Asian populations, younger populations in those neighborhoods. We're able to show, as well as, we see where the food retailers are located in Worcester, as well as we really were able to narrow in and show the SNAP gap in those neighborhoods, which is the difference between those who are eligible to receive SNAP and those who are actually enrolled in SNAP. And we saw significant gaps and greater gaps in those neighborhoods, again, where we saw those layered areas of oppression. That was validated again in our frameworks that we're using, in our survey data from community members, and in the mapping. And so we are actually pursuing now, and we're partnering with the Research Bureau as well as the Prevention Research Center, the Worcester County Food Bank, and many nonprofits and community organizations in order to be able to take our data a step further and actually ask from a kind of a human-centered experience from people how they are experiencing these resources and what are the actually specific, we're calling them like human-centered narratives of why people are not enrolling in SNAP, why people are not, food pantries, we say, help people who are willing to go to food pantries. But what are the experiences that are keeping people from using the resources that are there? And this is really helping us to strategically invest in both with our philanthropic organizations, our policymakers, and our program leaders, so that we're not just making assumptions on what people need. I know I'm speaking to the choir here, but food security is really an area where we see this really often. We see people, well, let's just start a new food pantry. That's a good, but we're really, what are the things that we can do, that we can invest in, that are going to be the non-sexy options, that are going to be the least photo op options, that are going to invest in housing, that are going to invest in accessible childcare, that are going to invest in SNAP education counselors to help to support people, and how can we validate and support that through our community. And so our community food assessment we're currently undergoing is leading site visits, community conversations, interviews, survey data, where we're asking people, we know there are resources there, we know that food insecurity exists, check, we have that in our foundation of data, but now what are the experiences that we're really showing, or what are the things, what are the strategies, what are the really responsive things that we could do that are going to help to meet those gaps. And so as we look for these, we're looking to develop equity-based programs and policies. We know that that in order to be successful in running the policies, they're going to be community-led, they're going to be responsive to what people are actually needing, because we're seeing it's not working with these blanket solutions, with the assumption-based solutions that we're doing. And so we're looking for programs and policies that are responsive to specific racial and ethnic groups, that are really responding to what people are saying their need and they're experiencing when they're accessing those resources. And we are working specifically with SNAP, as SNAP being an equity-based program that both invests in the economy by supporting retailers, but also as an entitlement program that people have this universal access to, and qualifying benefit amounts with household size and income, that we're able to then support people to have dignity of choice to be able to use that benefit. But we have to get over these really human-centered conditions of the stigma and the fear around access and the complications of the system. We want to get to the point where we don't need SNAP counselors in order to enroll people in SNAP, that the access is straight-lined enough to be able to do that. And we are creating policy recommendations, both through our SNAP coalition and with the Farm Bill at a national level, protecting SNAP benefits, and reducing time limits associated with SNAP, and supporting those frontline staff that are able to connect people to that. And we're also doing local work in order to be able to support our retailers. We're opting into statewide waivers to maximize access to SNAP, like the restaurant meals program that we did a lot of proving ground with. And then we're doing very local policies, both with working on our social determinants like inclusionary zoning, childcare access. We're working on a chickening ordinance to really help to empower that dignity and choice within our communities, in the ways that the communities are saying that they need that support. And we're, of course, not only working on policy, but we're also working on program. We're working with our cultural organizations in food delivery programs. We developed a hot meals program during COVID, delivering over 30,000 meals from local restaurants to people who are quarantining. And we are working on youth pipeline pathway initiatives for folks who are interested in both urban agriculture and farming, as well as food justice and food systems here as well. So a lot of exciting possibilities, but I would really want to just emphasize we are really intentionally grounding our work in this data framework in order to be able to build our investments in ways that are going to be the most impactful. And thank you. I think that's it for me. I'm happy to take any questions for a few minutes if anyone has any. Yes. I gave them to Eric. So I think those will be distributed, however, slides are available here. We also do have a website. I didn't link it on here, but foodhelpworcester.org and it has some of the linked maps that we use as our foundation, as well as it's a community resource where we list resources for different populations, whether it be school-age children, seniors, parents, neighborhood residents, and as a central way to capture food resources so people aren't sent to 15 different websites trying to access food. Yeah. Yeah, good question. I don't know the number, maybe David does, but on the food retailer. But I would say my off-the-cuff answer to that is we have kind of a lot. We have, I would say that Maine South is a neighborhood. It's one of our lowest income neighborhoods. We have a Latine supermarket, a large Asian supermarket. We have a Price Right, which is a discount supermarket with a big produce section. And so in that neighborhood of Maine South versus Bell Hill, which is another low-income neighborhood across the city that doesn't have a lot of supermarkets, it's on a really steep hill, it's just difficult with geography. We don't see a significant difference in food security between those two neighborhoods. And when we ask people, for example, like in our community food assessment survey, where are you shopping? Or, we're really trying to get into shopping habits. A lot of the answers people give us is, well, once a month I go to BJ's in Westboro, which is 25 minutes away. And so the assumptions that sometimes we make of, let's put more kale in the bodega, isn't addressing where people are shopping and accessing their food. Sometimes that is. Again, it's multifaceted solution, but I would say that we are moving a bit beyond the narrative of food deserts.
Yeah, I think really interested in this because Philadelphia, 25 years ago, we had very few supermarkets in the city of Philadelphia. Now we have lots. Mm-hmm. But I'm not seeing a commensurate decrease in food insecurity. Part of it is that, we cited supermarkets where there are a lot of SNAP eligible or SNAP help, but we didn't. I don't know that we did the eligibility versus enrollment.
Mm-hmm. Yeah. It's a really significant, and it's significantly different across different populations, which is where you really need to start dialing in to what people's experience is. I mean, I'm saying I would also caveat that with, I think supermarkets are a vital part of the system. And I know cities like Hartford, Connecticut, I know for a long time had one supermarket in a not that differently sized city. And it was a major concern and issue for them. But it needs to be housed. When you're facing a housing crisis like we are here in Worcester, and people are their budgets are being stretched to the limits, in order to be able to not have any food, then it's not going to matter that there's a supermarket right down the street.
What are the barriers you're finding to SNAP
I think there's a lot of paperwork, well, there's stigma, there's historical stigma and distrust of the government in different populations, that people have been harmed before by giving away their information. There's misinformation. In focus groups we said, we saw like, why would I give all my personal information so they give me $10 a month? It's like, well, you can actually get more than that. There's a lot of misinformation about that. There's people who think, well, I know other people are worse off than me. I want to help them. I don't want to take someone else's benefits, where actually that's not the dynamic that's happening. There's basic, limitations in people who have the time and capacity to wait on hold for 45 minutes to talk to someone, to submit documents 8 times. I've heard a lot from a lot of people, it's really difficult to get on, but then once you do, that, it's more easy to stay on for a long time, but getting over that initial barrier. And there's also, even for legally present immigrants here, there's a 5-year waiting period before that they can roll in SNAP. So if you're there's certain stipulations for some populations that under asylee status, but for some populations who are coming here, you're legally present, you're coming here, and you still have to wait 5 years in order to be able to enroll, which then, you're potentially setting up certain, tracks and resources as well.
So what's your estimation of the delta between eligibility and enrollment?
Well, David has the actual, specific data, I won't say, but I think we have pretty significant gaps in, I don't know, David, do you have, the actual, it was saying, what is our actual SNAP gap for City of Worcester?
Yeah, for the last 5 years, the monthly gap has been around 30 and 40%. But the way to measure that is comparing people who is enrolled in mass health compared to people who are actually receiving SNAP. So it's not a perfect measure, but yeah, it goes between 30 and 40%.
And I would also add to that, that's the average. The range, depending on neighborhood, is dramatic. So some neighborhoods are less than 10%, with others upward of 7. So it is a really dramatic shift between neighborhoods.
And does that track with other benefits? I mean, David, you just suggested it does. Does that track with health benefits? And we've been on a huge campaign to get people to enroll in EITC. Like we estimated there's like $100 million a year being left on the table when it's receiving a few-month planning. Obviously, the whole purpose of the federal government is to make it possible to get benefits. It's really ridiculous. That's why we have intermediate organizations like CECO, Benefit State Trust, and things like that. I'm just wondering if these track consistently.
I think it's different, right? Because also there's requirements for, I would assume, and I'm speaking out of turn, but for health insurance in Massachusetts, there's a requirement to show, you're gonna be penalized if you don't show that you have health insurance. There's different ways, I think, that some benefits are incentivized. Hi. Yep. I don't know, but that would be a good study. It would be. I would love to see more. And there's been lots of surveys. The Greater Boston Food Bank just did a statewide survey on barriers to SNAP access. It was so high level, it was hard to get to population-specific barriers and to really understand. But there's been work on this, but I think there's a lot more to understanding. What it's actually going to do. All right, I think my time is just about up. But thank you all so much.
Thank you, Casey, and thank you for being such a great partner. And I think the other element here that I think is obvious is the value of our research when played out with a community partner and someone who takes that work seriously in an aligned format. So the next section of today's program is the efficacy of racial equity sessions. And it's going to engage all team members, which I know from talking to my colleagues as executives, just how much we all recognize, particularly looking around this room, the importance of it, not just from a research agenda standpoint, like the topic we just discussed, but as employers, as community-based organizations with our own boards, in how it needs to permeate all of our decision-making and all of our operational approaches. So we're very fortunate today to be joined by Robert Jones. I'm personally fortunate in that he asked me not to read his bio because it's very impressive and very long. I will note he's formerly the program director for the National Conference of Community and Justice, Rhode Island and Southeastern New England region. And the section here that jumped out to me, forgiveness, but since 1989, he has made a firm commitment to become an integral part of the ongoing struggle to bring an understanding of the value of diversity, equity, and leadership, systems of oppression, and the dynamics of power and inclusion to the workplace as well as the classroom and the community. So I can think of no one better to talk to us today. Thank you, Robert.
Okay, folks, I'm going to use this mic because I just can't stand behind the podium. Testing one. Okay, great. So, thanks so much. My professional profile is like a full page. It's like 600 words. I was like, don't read that. Okay. The down arrow. Yes. There we go. There we go. So, well, a couple of things I will sort of highlight is I've had this company, Teely Associates, since 1989. My most recent full-time job, I was the past associate director of multicultural education right here in Worcester at the College of the Holy Cross. 16 years. It was really good. I also work with Casey. I'm a senior facilitator of the Worcester Trauma, Resiliency, and Racial Equity Institute, where what I'm going to be presenting today is other stuff. We kind of do all over New England. Also, DEI partner with the Rhode Island Association for Infant Mental Health. I also work with the University of Rhode Island Office of Strategic Initiatives for the Rhode Island Department of Health and Human Services and their Department of Administration. And right here in Worcester, I partner with the Central Mass Housing Alliance, which is the largest organization in Central Mass when it comes to dealing with unhoused persons. So, let's keep this going. So our goals for today to understand the what, how, and why of racial equity sessions. Going to go over some of the different components of these sessions, and then talk a little bit about the challenges and benefits of the sessions. So in order to do that, I'm just going to go over some of the things that I do in a regular sort of 2.5-hour session. And usually when I do racial equity sessions, it can go anywhere from 2.5-hour sessions to 3. But before I go into this, just also want to let you know that racial equity sessions are just one part of dealing with what I call diversity, equity, and inclusive excellence. And so if you can just picture in your mind equity being in the center, and around that center of equity, we have everything around identity and socialization. We have power dynamics. We have systems of oppression. We have gender equity. We have accessibility equity. All of those things together. And one that I think is really important is how to have these conversations. I call it the art of the difficult conversation. So the way I start out with all of this is to really create an environment with guidelines where we can have a safe enough space. Some of you have probably heard brave spaces and courageous spaces. I don't know about you, but I don't know that many brave people to really talk about this. So I say a safe enough space. It's just so as professionals we can have this dialogue. So, okay. I didn't do this, but I thought it'd be interesting, so I'm going to put them all up and just have you kind of read along. When we downloaded it from Google Slides, it did this. So, the first is to engage in open and honest dialogue. Participate fully at your comfort level, +1. Speak from personal experience. Listen respectfully, seek to understand. Listen harder when you initially disagree. Move in, move out, encourage others to participate. Try to be as fully present as you can. And be open to new and different perspectives. Assume good intent. Explore the unintended impact of comments and behaviors. Take risks, lean into discomfort. Be as brave as you can. Respect and maintain confidentiality. Recognize your triggers, and please share with the group if you feel triggered. Trust that through dialogue we will reach deeper levels of understanding, and please engage in this opportunity. What we're going to be talking about today, for a lot of us, is not like common discussion. You know, we don't always have that. So, thoughts, comments, questions, any of these resonate with you, or is there something that perhaps we could add? You could just raise your hand. Questions? Yes?
I mean, the only thing I would comment on is one thing, and maybe you kind of have it up there, I was looking to make sure I didn't forget, is to get curious,
To-
to ask questions.
To get curious. That's a good one. I think when you're curious, you learn more. You learn more. Thank you. Does everybody know what a trigger is? Not like a gun trigger, you know. Okay, great. Okay, so these are some things to consider when talking specifically about race. Specifically about race. I think it's the battery. Here we go, here we go, here we go, here we go. Oops. Other way. Other way, other way. Oh gosh, I gotta do this. That's okay. These were supposed to zoom in. Okay. Go slow, go slow. You do it for, okay. Yes, go back. Nope, too far back. There we go. Patience is a virtue. The next slide is what I use specifically for racial equity sessions. And that is, a strong opinion is not the same as informed knowledge. There is a difference between agreement and understanding when discussing complex social and institutional dynamics such as race and racism. Consider whether I don't agree may actually mean I don't understand. We have a deep interest in denying the forms of oppression that benefit us. We may also have an interest in denying forms of oppression that harm us. For example, people of color can deny the existence of racism and even support its structures. This denial may keep them from feeling overwhelmed by the daily slights or protect them from the penalties of confronting white people on racism. However, regardless of this reason, this denial still benefits whites at the group level and not people of color. Racism goes beyond individual intentions to collective group patterns. We don't have to be aware of racism for it to exist. Okay. Our racial position, whether we identify as white, a person of color, or multiracial, will greatly affect our ability to see racism. For example, if we swim against the current of racial privilege, it's often easier to recognize, while it's harder to recognize if we swim with the current. Putting our efforts into protecting rather than expanding our current worldview prevents our intellectual and emotional growth. Thoughts, comments about these things I'd like for you to consider. Make sense? Okay, thank you. Next slide. So this is an exercise that I'd like everybody to do. It's called Find the F's. I'm going to do this individually, and I want you to find the number of F's in the following sentence. Fairness is the final result of years of effective effort combined with the experience of diversity, equity, and inclusive excellence. the number of F's. And if you've done this before, just wink at me. Okay, the number of F's. Okay, I think the next slide. Yep, you can put that back. There you go. It's a little bigger now. So, just by a show of hands, and I'd like you to look around and see who's raised. How many of you see a total of 6 F's in that phrase? Raise your hand. Just raise it. Take a look around. See, you're in the 6F family. 7 F's. Raise your hand. Okay. 8 F's. Okay. 9 F's. Okay. So, how many F's are in that phrase, folks? What's the correct answer? And by the way, if you didn't look around, we had 6F, 7F, 8F, and 9F people. We're all looking at the same thing. Something that you don't know about me is for 15 years I worked for the Mobil Corporation in Houston before Exxon took them over. It wasn't a partnership. They took them over. And that was the only organization, or one of the early ones, that I actually saw this work at. And so they had folks not taking all of their sick days. Complaints between employees went away because folks kind of worked everything out. It was amazing. But in Houston, they have a phrase. Anybody know a famous phrase that has the word Houston in it? Houston, we have a problem, folks, because you're sane professionals looking at the same phrase, but see different numbers of F's. Next slide. So how many F's are in that? Say it again, my friend from Philadelphia. 9 F's. 9 F's. The reason I start out with this is because all of us are fairly smart and we know what we know. But you know, looking at the same thing, looking at the same incident, looking at a same situation, we see it differently based on who we are. Now, could you imagine if I said, all the 6, 7, and 8 F people, you can now leave? Some of you would be very happy, right? You leave, get some time to yourself. Because I only want 9 F people, people that can see all of the F's there. It's the same thing when dealing with anything with diversity, equity, and inclusive excellence. We see the world the way the world is. No, we see the world the way we are. The author Nathan said that. We don't see the world the way it is, we see the world the way we are. And we are a culmination of our lived experiences. And we all have different lived experiences. So as I go through this, just try to identify your hidden F's, the F's that you didn't see. Especially, you know, I can get the 6 F people, right? You left out the F's and of, right? Small word, plus it sounds like a V. But if we left that word out, that wouldn't make any sense. So it's very important. It's the 7 and 8 F people that get me. You see some of it and you don't. And I think that's most of us. Most of us get it, but there's 1 or 2 things we don't get, especially when talking about racial equity, based on who we are and our own personal lived experience. Okay, next slide. So today's agenda, very good. We're doing the welcome. We did the goals, going over the agenda, creating safe space. In a minute, we're going to go over some vocabulary and talk about the sessions. Then we're going to talk about, you know, what racial equity is, you know, how do you do it and why we do it, and go over some key components. And we'll end with some questions, thoughts, comments, and we will finish at 5 p.m. Sounds like a plan? Okay, great. Okay, what I'd like to do, anybody here like to read out loud? I need 4 volunteers. I have 1, 2, 3, 4. Great, wonderful. So we have 4 words I think are very foundational to talking about racial equity. So we're going to talk about race, racism, racial equity, and white supremacy culture. And so I don't like to hear myself talk, so why don't you take the first?
Race, a social political construction created to concentrate power with white people and legitimize dominance over non-white people. An individual's awareness and experience of being a member of a racial and ethnic group, the racial and ethnic categories that an individual chooses to describe him or herself based on such factors as biological heritage, physical appearance, cultural affiliation, early socialization, and personal experience.
Thoughts, questions, comments about this definition of race? Make sense? One question. Okay, next slide.
Racism. Racism specifically to refer to individual, cultural, institutional, and systemic ways by which differential consequences are created for groups historically or currently defined as white, being advantaged, and groups historically or currently defined as non-white, Black, Asian, Latinx, Native American, as disadvantaged. That idea aligns with those who define racism as prejudice plus power, a common phrase in the field. Combining the concepts of prejudice and power points out the mechanisms by which racism leads to different consequences for different groups. The relationship and behavior of these interdependent elements has allowed racism to recreate itself generation after generation, such that systems that perpetuate racial inequity no longer need racist actors or to explicitly promote racial differences in opportunities, outcomes, and consequences to maintain those differences.
So you all understand I do come from academia, so you can tell, right? I was a professor, yeah. Thoughts, comments, questions? Anything resonate with you? Yes. Mm-hmm. 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 It's, as someone, say again? It's structural. It's also like the air we breathe. If you are born, not born, but if you're raised in the United States, we're socialized to sort of buy into. We all know very early, you know, what you have to do to succeed, right? And so you have to kind of fit in, you kind of go with the flow. I have some friends of mine who have middle school students now that they're taking on mission trips. They're like in the 7th grade, 6th grade. And I'm like, why are you doing that? And they're building their resume for college. And I'm like, they're 12. It's a little late. It's a little late. Exactly. I said, you should send them to camp, not to go to Ecuador to build a school, which is very great and noble to do. At the College of the Holy Cross, very interesting. Went on mission trips all the time. It's a Jesuit university. We went to Haiti before all of the mess happened there, and we went there to build fences around schoolhouses and paint them. And one day we finished around a complex of high schools and middle schools and elementary schools, and a young Haitian man said to me, "Thank you so much for building the fences and painting them." You know, and I was like, "Oh, that's what we're here to do. We want to help." He said, "You know, we can build fences and paint them. You don't have to come from the United States." So we asked him, "What would you rather us do?" He said, "If you can get us 700 laptops and give us Wi-Fi access for 3 years, we could really use that." And for the next 10 years, that's what we did. And we didn't make the trip down there to build fences and paint them. It was a teenage high schooler there. And but he tricked me because he was like, "Oh, I just want to thank you for doing that." And I was like, "Oh, this is great. This is what we do. It's part of the Ignatian principles." And then he said, "But we can do that. You don't need to travel here." Okay. Next slide, please.
All right, racial equity is the condition that would be achieved if one's racial identity no longer predicted, in a statistical sense, how one fares. When we use the term, we are thinking about racial equity as one part of racial justice, and thus we also include work to address root causes of inequities, not just their manifestation. This includes elimination of policies, practices, attitudes, and cultural messages that reinforce differential outcomes by race or that fail to eliminate them.
A little wordy. Thoughts, questions, comments about racial equity? In a nutshell, when I talk about racial equity, I'm talking about providing access, opportunity, and resources for what every person needs to achieve. What a lot of people need to understand is that once you achieve racial equity, that doesn't automatically mean you're going to get the outcomes that you think you're going to get. Does that make sense? But when you have a system where people do have access, they have the resources and everything at their fingertips, if they would like to achieve, that's great. As we can see with the SNAP benefits, a lot of people are eligible, they just don't apply. And there's a reason why. And so getting at the root causes of that, and that's what Casey was referring to about upstream, going upstream to find out why are we getting these outcomes. Okay, did I have one more volunteer? Oh, there we go. Okay, you get the last one. Okay, I'll read this one. A mindset and method for solving problems that have endured generations, seem intractable, harm people and communities of color more acutely, and ultimately people of all races. This will require seeing differently, thinking differently, and doing the work differently. Racial equity is about the results that make a difference and last. One more. Okay.
White supremacy culture refers to the dominant, unquestioned standards of behavior and ways of functioning embodied by most institutions in the United States. These standards may be seen as mainstream, dominant cultural practices. They have evolved from the United States history of white supremacy. Because it is so normalized, it can be hard to see, which only adds to its powerful hold. In many ways, it is indistinguishable from what we might call U.S. cultural norms, a focus on individuals over groups, for example, or an emphasis on the written word as a form of professional communication. But it operates in even more subtle ways by defining what normal is, and likewise what professional, effective, or even good is. In turn, white culture also defines what is not good, at risk, or unsustainable. White culture values some ways of thinking, behaving, deciding, and knowing, ways that are more familiar and come more naturally to those from a white Western tradition, while devaluing or rendering invisible other ways, and it does this without ever having to explicitly say so.
Thank you. Thoughts, questions, comments? It's got to be one. Trigger. And it's up to you if you'd like to share what the trigger is for you.
I'm just thinking about going back to Alabama and explaining white supremacy. We had it for sure. I mean, I think Alabama it's written into our constitution. Stays flying. If I were to put this stuff at the top of it, there would be a negative reaction. And it kind of goes back to the racism definition, which is very interesting to me. You got the second part of the definition which said you don't have to have racist to have a racially negative system.
Mm-hmm.
I think if we could get people to jump over trigger words like that and try to understand that part,
Mm-hmm.
the hard part would be able to then I
Sure, sure. And so I usually start out with vocabulary because so many words and phrases when talking about diversity, equity, and inclusion, they get mixed and matched, or people have just so many different ideas of it. And I always was taught that in order for us to have a very cogent and beneficial conversation, we have to be in the same book and on the same page. We have to have a common agreement as to what these words mean. Otherwise, we can have a big disagreement when really it's a misunderstanding. Mhm. 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 Oh, I understand you. Does everyone else understand what he's saying? One thing I like to tell people is um, this white supremacy culture, I'm going to use the metaphor again, it's like the pollution that we breathe. It's not a white person's individual. It's not a white person. We're not saying you. I'm saying this whole country actually is globally. When you think about it, it's like the air we breathe. None of us woke up this morning and said, I'm just going to breathe good air. No, we're going to breathe like the air. And now with the social media and everything on TV, we're all exposed to the same thing, which is why someone pointed out earlier, we don't even need individual actors anymore. Part of that first session, we go into structural and institutional racism and what that looks like and how that plays out. And so it's not, it affects everyone across the identity spectrum. It doesn't matter what race you identify as. Matter of fact, there's a video that I show that talks about if all persons who identified as white left this earth tomorrow, white supremacy culture would still be here, and people of color would be practicing it, if that makes sense. It's a part of who we are. It's the good, the bad, and the ugly with it. But it's not something that is attributed to a specific race. At the end, we're going to end with a short video. A lot of people don't even realize how the term white came about. Historically, folks, you know, prior to the establishment of the United States, prior to like the 1600s, the word white appeared, you know, as a collective identity. Oh, sorry. That is the, I got to put money in the meter, but it doesn't appear till like after 1687. Prior to that, how were people in Europe categorized? How were they identified? By nationality. And guess what, folks? There was a hierarchy. There was a definite hierarchy. You know, I often ask people, I said, which came first, race or racism? Which came first? Together? You said racism? Creating this hierarchy. You know, prior in the 1500s, people were identified by geographic location, where you came from or your country, nationality. And there was definitely a hierarchy. Who was at the top of the food chain? The Brits. Who were kind of at the lower end? Huh? The Irish. Oh yeah, the Irish, the Scottish, and the Eastern Europeans. Just a little fun fact here. The word slave, anybody know the root cause? The root? Slavs. A lot of people don't understand the most enslaved people on this earth of humans were the Slavic people. And it continued up to the beginning of the 20th century. How would you know that, right? You wouldn't. But that's how you got the word slave from it. But when we have the sessions, we go a little bit deeper into it, and we address those triggers, you know, and talk about it, because sometimes folks hear that and then they get guilt, and it's like, well, you actually didn't do it. But at the same time, saying it doesn't exist, those are the folks I like that go, yeah, we're fair and equitable. I love the founders of our country. They were flawed a little bit, right? Just a little bit, you know. 3/5 of a human being, that was actually in our Constitution. So I love discussing this subject with constitutional purists. You know, good thing. Okay, Thank you for that and sharing that trigger. The reason why I like folks to share the trigger is because have you ever been in a conversation with 5 people, someone says something and 3 people get totally upset? Totally upset, and you say to your friend, what just happened? And then they just walk away. And you're like, what happened? You know, but it's good to know because we have different lived experiences, you know. Okay, next slide. So these are just some of the racial equity foundations or principles. First of all, when talking about racial equity, it's lifelong learning, has a lot to do with self-reflection. Vocabulary is important, as well as critical theory. Theories about how race came about. The history and the root causes of it, the tenets of white racial supremacy, the challenges and benefits, and policies and solutions. Now, what I did was build upon this foundation to come up with what we call the tenets of racial equity. And this is what the different sessions are based upon. The first is self-critical reflection. So understanding the experiences or lack of that have led to our current worldview on race, examining our socialization, relationships, and decision-making through a racial lens. I love it. I have some godson and daughter, and they're white. And what's great is, you know, we go over the house when they were younger. I'm getting old. They're in their 20s now. But when they were younger and folks would come to their house, they would ask them, they was like, who are those black people over there? And they would say, oh, that's my brown godfather. And the adults would get embarrassed, not the kids, right? Because what did the kids see? A brown-skinned person who's the godfather. And that was it, you know. But when people say to me, you know, Rob, I don't see you as a black man. I just see you as a good human being. And I was like, you need to wear my glasses because I am brown-skinned, but identify as black, and I see you. And so we do see color. The issue happens when we put a value to that, because color just is the way you look. Historical context and perspective. Understand the events, decisions, and conditions that have occurred that have led to the present racial dilemmas that we're currently facing. Any of you familiar with the Chinese Exclusionary Act? Yeah. When I tell people, it's like, they go, what? I said, yes, the Chinese. The only way you could get here if you were from China, you had to have a job, had to have a sponsor. And people say, is there a connection to why there were so many Chinese restaurants and Chinese laundries, right? Because you had to have a business so you can guarantee a person had a job. And does anybody know when that was abolished? 1968. Yeah, 1968. As well as a whole lot of other immigration policies. Identifying manifestations of inequity, naming the racial inequities and their impact. As researchers, you come upon a lot of inequities, a lot of things, and being able to understand the context in which it happened. RRB here, Central Mass Housing Alliance was doing something, and they had some data when talking about redlining. Folks are familiar with redlining. We're talking about it, and it was really interesting because of some of the words and phrases they used to identify people at that time. Anybody know WAP, without papers? They used to identify folks of Italian, and it was in the report, and they were like, oh, I don't know if I could say that. I said, you need to say it so people can understand what was allowable then that's not allowable now. Does that make sense? You know, rather than say Italian Americans, it's like, that's not what they called them in 1923. That's not what it was. Root causes, determining the conditions that are and have allowed the challenges to manifest and taking action to address those conditions, and exploring the tenets of white supremacy culture. We came up with about 12 of those things, and it's very, very interesting because as you go through them, I know I went through them, I was like, yeah, I do that. I do that. You know, things like sense of urgency, you know, those kinds of things, you know. Right now, what's happening in workplaces, some of you might be familiar with it. We're requiring for managerial or supervisory positions, we're requiring master's degrees. And then you might have someone who worked there for 12 years, that can't apply for that job, but they have the experience, then we hire someone with a master's degree with 3 to 5 years work experience to be their manager. And then we ask them to train them. Sound familiar? Yeah. And folks are like, what? Next one. Policy and process review, examining current policies for equitable, inclusive language and meaning, examining the process involved in operationalizing the policies, bridging the gap between policy and the process that ensures integrity. I work with a lot of organizations, and we do racial equity audits on their policies, and guess what? 98% of the policies are spot on in terms of equity. Where does the problem occur? Humans. How we actually implement the policy. And our own internal bias comes out, all kinds of stuff. Not meaning we're bad people, but we do pay equity audits, and you find you hired 5 people back in 2018 for the same exact job, and there was a $30,000 disparity in the pay. Nobody is equal, but same job, same pay grade. Guess who got the 2 highest salaries? White males. Who got the 2 lowest? It was a black female and a Latinx male. Guess who got the middle? The white female. And automatically, what do you think their response was? We got to find out who was on that hiring team. Like punitive. And we said, that's not why we did this. We did this so that we can make sure going forward we don't have that same sort of issue. And all of those people, great people. Great people. But sometimes we know ourselves and we don't, right? You kind of just do that. Data collection and analysis, determining the best data to collect to identify gaps in racial equity, demographics, salary, roles, responsibilities, geographic location, etc. And this is the challenge, to analyze that data free of implicit bias. But I mean, it's implicit, right? That means you don't know. You know, that's why it's great to have a team to look at the same data. A multiracial team, you know, across the gender spectrum. You know, you just need to have it. What's really interesting, I worked with a group who were trying to get poor students of color and poor adults into colleges, right? Get them into higher education. All 34 people, guess what their economic status was? Upper middle class. They had no lived experience of anyone poor. And so imagine trying to sort of form that relationship and try to understand it and see things through their experience. Not that it can't be done, but it has to be done very intentionally, very intentionally. And resource allocation, putting resources where they're needed to achieve the racial equity. Does this make sense? And so in the sessions, we kind of go through that. Strategic and tactical approach, understanding and developing the overall foundational strategy that will lead to racial equity before developing the tactics. What I love about organizations, they want to do so quick. But I always say, whenever I deal with any clients, I say, if whatever we did worked, what 4 things would change? And if you can't articulate that, don't do anything. Just slow down and just don't do anything, because whatever you do, if you don't know what the expected outcomes are, how are you going to sort of win other people over and tell them this is the right thing to do? So I always say we need a strategy before we start the doing. But most of us, and I'm just going to assume most of us in this room, because of what you do, we're doers, right? We're doers. I learned about 3 years ago, if someone came to me with a problem, sometimes they just want me to hear them. Because if you come to me with a problem after you say that, I say, okay, so step 1, what are we going to do? Step 2, step 3. And a good friend of mine said, sometimes people just want to be heard, they want to be seen, and they want to be valued. So I slowed down, and guess what happens? 2 weeks later, that person says, yeah, I'm ready to do something. So strategic planning will answer to who we are, what we do, and why we do what we do, and who we do it for and with. The tactics will answer the how we do it. And like I just mentioned, articulating success, determining what would change, be different, improved because of addressing your challenges through the tenets of racial equity. So that's what the 2 to 3 workshops sort of would do. Yep, next slide. So the why. So why do we want to do this? Some things with my years' experience is to create a more equitable and authentic workplace. For professional development, you know, back in the early 90s, prior to the 21st century, we didn't do DE&I work as something separate. It was a part of organizations' regular professional development. For some reason, in the around 2010, we changed it and made it DEI. But what I found is when you make something an extra, it's easy to cut it, you know, because it's an extra, as opposed to just folding it into all the other training that you give to your workforce. You get better at your job and your profession. Developing a racial equity lens as well as an overall equity lens, as I said in the beginning, will positively impact how we see others and others see us, peers, partners, clients, the community, etc. And I do all of this work on the basis of we all can do better. We all can do better. And that's sort of what drives me, is wanting to be better, get better. We won't be perfect, but we can always get better at whatever we're doing. Next slide. So this is just a picture of the racial equity framework, a lens. So you have your racial identity, and then when you develop that racial equity lens, you see policies, outcomes, power, relationships, and solutions a little bit different. Again, it allows us to see our context in new and revealing ways when it comes to relationships, policies, outcomes, power, and solutions. But not just racial. But one thing in doing this work, I've seen the metamorphosis of when we first started doing it. And if some of you are around, like in the late 80s, Phil Donahue show, showing my age now. Remember, you know, early when I did workshops, guess what? When we did a racial equity workshop, we would say it was a good workshop when we had like at least 5 people crying. And like, oh my God, I'm such a bad person. You know, crying. Remember Phil Donahue? People were fighting. It was crazy. But then the backlash happened. And then at around 1990, from 1990 to 2000, guess what? We didn't talk about race. But we talked about everything else, right? That's when we started talking about LGBTQ issues, accessibility started, but we never talked about race. And I think as a country, United States, once we can get comfortable in talking and addressing racial issues, not that the other issues will be easier, but I think it will be a little bit easier to talk about accessibility, to talk about gender equity and all those kinds of things, you know. And so that's why after around 2015, we started talking about it again. When I went to the College of Holy Cross in 2008, they told me, they was like, Rob, don't talk about race. Do everything else, but don't talk about race. Then something happened in 2014, 15, right? Black Lives Matter started. They was like, Rob, you got to do race. Because I said, why? They said, because everybody's doing it. And we'll talk about trends and things like that. Does this make sense, this visual? Okay, next slide, please. So some of the challenges and benefits. The challenges, like I just said, some of us have been around for a while, and I'm quite sure we could come up with 2 or 3 things that the company made everybody do for 2 or 3 years, and then all of a sudden, we never did it again, right? Just kind of went away. So it becomes trendy. Or, as some people often tell me, this is going to be another workshop that's going to lead to nowhere. And I often tell organizations, getting back to strategy and tactics, don't do anything unless you have like a 3, 5, 7-year plan to continue doing this. Otherwise, and some of us in here might be this, you develop people and turn them into curmudgeons, right? Some of us, right? It's like, oh yeah, another workshop, okay. I'm just gonna go, I'm not gonna say anything, it'll be over. And then everybody will forget it. It's also very trendy. Has nothing to do with my job or with me. right? You deal with data, like, but you do talk to people, right, to get data, right? You have to interpret that data. It's a waste of time because I have work to do. I have work to do. And in some organizations, they get workshopped out. Anybody ever work for an organization like that? Like every month, it's like 2 or 3 workshops, and you got to go to it. But the benefits are you have better work relationships. Better work relationships. The teams operate much, much better. Folks feel, as I said earlier, that they're seen, they're heard, and they're valued. One word that's very trendy in this industry that I don't use, but you might be familiar with, belonging. I say it that way because I'm like, yeah. So there's a lot of groups that say, Rob, can you help us get a diversity, equity, and inclusion and belonging group? And I'm like, oh, not belonging. See? With the belonging. But people want to be valued. They want to feel that they're there. And, going back to what I said about, the requirements we have for managerial positions, a lot of folks be with organizations over 15 years in the same position. They don't see any mobility or upward mobility. And I always advise organizations to grow from within. Grow from within. People stay longer, and they really feel like they belong. And you will become the workplace of choice and the client of choice. The client of choice. What's happening now is, I know in the nonprofit world, a lot of philanthropic organizations are like, yeah, what's your DE&I strategy? Or else you can't get or apply for the funding. They're doing that. A lot of large organizations, philanthropic organizations are doing that. But also you want to be the client of choice. Folks will see that you're interested in this and you're doing it. Next slide. Okay, before we get to that, thoughts, comments, and questions. I know that was a lot. I know it was a lot. But does it make sense? Questions? Now remember, this can't be done as a standalone. It has to be done in conjunction with an overall strategy. You can't just look at racial equity. You also have to look at gender equity. You also have to look at accessibility. You also have to look at, this is the third world in the United States, class. You have to look at socioeconomic class. You have to look at all of that. But I usually start out with talking about identity and socialization, What have we learned about being who we are and who others are? What have we learned about, who the good people are and who the bad people are? Who the people you should associate with? Who are the people you should hire and not hire? How do you talk to people? Who don't you talk to? All of those things. And it's not for judgment, but it's about getting better, especially at your profession, at what you're doing. And it'll spill over into how you are as like a whole person, but we're talking about in the context of the workplace, Questions, thoughts, comments? Okay, we're going to end with this short video on how America...
Hey, you.
Okay, here
Caucasian. Caveman. Hey, Blanco. Gringo. Paleface. I gotta tell you a secret. Guni. Hunk. Muzungu. This might come as a surprise, but white people, listen to this. In America in the early 1600s, you didn't exist. You didn't exist? I hate to break it to you like this. Listen to what your history books missed. What would be made white were completely unrelated, under-melanated people. Frankenstein, collaged by an optical illusion. The ultimate mirage called race. A social construction like Santa Claus. Back in the day, y'all either English or Scot, Irish Catholic or Protestant, land owning or not. But you can't have white without black in America. Back before we was Captain America, black wasn't a race. Africans came from different nations, like in Dongo, where Queen Nzinga reigned. Indigenous were the same, Powhatan, Doeg, regardless of tribe, melanin didn't determine fate. Skin color didn't make a difference, no matter what hue your flesh was tinted in, cause your complexion wasn't kinship, and pigment was insignificant. It didn't prevent you from certain privileges. This is the story of how skin became color, color became race, and race became power. The creation of the Caucasian, white Aryan. It's the story of how white became American. The census says your race is white, you don't believe the hype. 1650, Jamestown. Meet William Berkeley, appointed by King Charles II of England to govern colonial Virginia. He rules with an iron hand and enriches a small cadre of English landowners. They grow tobacco. The sweet leaf is gold. America's first road to riches. Yeah. Hey, to grow the crop, they kidnap and capture men, engaged in human trafficking and trap the African. And if they can't steal the labor, then they use lies as lures or false promises as tools to recruit all the poor from Bristol to Liverpool. Little did they know that they were in for something cruel. Jamestown was their destination. When Berkeley looks at his servants, what does he see? Color, of course, but color doesn't mean much to a man of means.
They're heathens, waste, dirty, diseased, lazy animals. I would sooner call my hound brother than a servant of any shade.
Under God and by law, he has the right to whip, maim, starve, buy, or sell them at his pleasure. But he fears them. He should. The rich are few, and the poor are many. It's almost impossible to imagine now, but the poor see themselves as one. They have a common bond and a common enemy. Together. 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 The Africans and English worked together. They labored and lived, prayed and made a life together. Stole, escaped, hold and wait together. They got lashed and went to jail together. Worked hard and catch hell together. It wasn't criminal for them to love together. Got married and had kids together. The colony was filled with different shades together. Mahogany, tan, olive, and beige together. Molasses, dark chocolatey flavors together. Peach, bronze, amber, and brown. But very soon life would change up in Jamestown. There's no lifetime slavery yet. The indentured Europeans and Africans can still buy their freedom. Released from bondage, they'd set out in search of land. For these new frontiersmen, freedom is a rotten promise. The rich own all the good soil, and the indigenous tribes desperately grasp for the rest, fighting for every acre they have left. The frontiersmen seethe with each new tax, each broken promise, each death, each rich man that grows richer, each poor man that grows poorer, until they can't take it anymore. 1676, time to take matters into their own hands. They cast one Nathaniel Bacon as leader, the son of an aristocrat who came to the frontier after squandering his inheritance. Under Bacon, they band together to take land from the tribes and power from Berkeley. Together. 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 Get your guns, get your knives. First target is the tribes. Kill the men, women, and the children. And the children. 100 men turned into 1,000. A posse-turned guerrilla army is astounding. And Ndongo, English, Angolan, Irish fought together to abolish all the tyrants and the snakes, ready to mount their heads on stakes. Enough of these rich men, of these false men, corrupt men. Light the torches and set Jamestown ablaze. Let it burn, let it burn. Jamestown put the ashes in an urn. 100 years before the revolution, Africans and Europeans were in union. Let it burn, let it burn. The British never wanted us to earn. So bring the fire to the upper classes. We can make a better future from the ashes. Berkeley watches Jamestown burn, and he burns with vengeance.
The waste must be cleansed from God's green earth.
Behind a British gunship, retribution. Berkeley hangs 20 and scatters the rest into the wilderness. The rich of Jamestown know it could have been their own necks hanging from the end of a poor man's noose. To survive as rich men, as powerful men, they vow never to let the poor rise up again as one. But how? What scheme? What deception? In 1681, white will appear in a legal document for the first time in history when Virginia bans Africans from marrying whites. One law of dozens creating and separating the races. Blacks across the colonies will be enslaved for life, no longer treated as human, but as property. Poor whites were handed the whip. The rich exploited their ignorance. They traded rebellious plots for managing slave auction blocks, and any chance for both of their freedom was lost. It doesn't happen overnight, but the rich divided people by phenotype. Melanin, skin color, you dark, you light. Your life or death could be determined by the question, are you white? Well, are you white? Go ahead. Take a look in the mirror. Ask yourself, am I white?
Okay. Go have a great time. No, I'm kidding. Thoughts, comments? Anything resonate with you? How many of you are familiar with bacon? Southern
All right, everybody. So we are taking a break until 7 o'clock when we do our dino rounds. On the back of your name tag is the name of a restaurant. You're either going to a wonderful ramen place or an Italian place or a tapas place. And if you lost your name tag, I think talk to Eric because he probably has a record of where you're going. I am sad that I'm only going to be able to eat dinner with a third of you, but it would be a big table if we all got together. So we'll see you tonight at 7, and then tomorrow morning we've got some cool breakout sessions. We're starting bright and early at 8 o'clock, and we're back here at 8. Okay, great. So see you guys all at 7 o'clock. Oh, and we're meeting up in the lobby of the hotel, and we're going to be walking a short distance to the respective restaurants from there at 7 o'clock. Lobby at 7 o'clock. Or actually, yeah. 6:45. Good question. 6:45. We'll see you then.